Welcome to the MamasteFit podcast. In this episode, we have pelvic floor physical therapist Hayley Kava here, who is going to be talking all about diastasis. We'll discuss diastasis during pregnancy and in the postpartum and how you can approach healing it out of the box. Welcome to the MamasteFit podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit podcast. In this episode, I have one of our in-house pelvic floor PTs, Hayley Kava, here with me. So, Hayley, could you introduce yourself to our listeners who may or may not be familiar with you?
Yeah, my name's Hayley Kava. I'm a pelvic floor physical therapist who specializes and is certified in postural restoration. And I like to approach pelvic floor problems, pregnancy and postpartum problems with that outside of the box approach.
So let's start with defining what is diastasis. This is like, some folks call it like abdominal separation, DR, DRA, diastasis, diastasis. So can we just define like what that is?
Yeah, so diastasis, like the word diastasis, just basically means that something is separating. So you could have diastasis in other parts of your body, but a diastasis rectus abdominis, or DRA, is the separation of abdominal muscle sort of through something that's called our linea alba. So the fascia that connects the left and right side of our abdominal wall in the middle.
Okay. So during pregnancy, I understand that diastasis is a normal adaptation. Like as our baby grows and our belly stretches, diastasis needs to happen in order to accommodate for our baby's growth. And so we'll have folks that'll message us that's like, hey, how do I prevent it? Or I noticed some coning, like I'm so upset that I got diastasis. And I just want to reiterate that it's a normal part of pregnancy. It needs to happen. But there are things that we can do during pregnancy to help minimize the severity of it. Do you have any insight on what someone could do during pregnancy to, one, acknowledge that you're going to probably have some sort of diastasis, but what could they do during pregnancy to try to minimize it for healing in the postpartum?
Yeah, so I think it's important to remember that the abdominal wall is more than just our six-pack muscles, right? And I think aesthetically, we think about our six-pack muscles and what they look like, or what our belly, what our abdomen looks like, from like a purely, I don't know, aesthetic standpoint. But there's a lot of layers there. So we have the rectus abdominis, which is sort of the middle, like our six-pack. And then we have our external obliques, our internal obliques, and our transversus abdominis. And so all of these muscles are coming to that midline. And yeah, if you make it to full term, like sort of, or third trimester even, 95 to 100% of people who are pregnant will have some thinning or stretching at that linea alba. It just has to happen in order to accommodate the uterus growing. So yeah, you could do all the right things. You could do all the core work you want. You can do all of that. And it is sometimes just gonna happen. The amount that tissue thins and the integrity of that in the postpartum healing period we can influence is that we want to consider where all of those muscles, right? So we've got this complicated wall of muscle. We want to consider where those muscles start and where those muscles finish, and then what their actions are. So just like our hamstring starts in one spot and ends in the other, and we want to train that muscle through its full range of motion. Same thing with our abdominal wall. Those abdominal muscles attach from the rib cage up here all the way down and attach on the pelvis. So we can't think about it just in the middle. We have to think about it as an entire sort of wall of muscle. So the things that we want to do to address in pregnancy, despite normal changes that are happening in our rib cage at the top and in our pelvis at the bottom, is addressing that positioning, right? So if as belly's growing, as baby's coming out of the pelvis and rib cage is maybe expanding or like flaring forward, we want to do things to try to rein that in a little bit so that then that ab wall is not getting just tensioned continuously throughout that pregnancy. And then positioning our pelvis at the bottom as well. So we don't want that pelvis unchecked, continuing to go more and more and more forward despite that belly and that uterus growing more and more forward. So the things that the warm-ups that we do or how we're strength training and our awareness of that is really important, as well as recognizing that those changes don't always all happen totally symmetrically. So the left and right side of our body is a little different. Often babies don't hang out right in the middle, right? They may prefer one side or the other. It might be flip-flopping from side to side. And so that causes sometimes like asymmetrical changes of the rib cage as well. So we want to be conscious of not only symmetrical typical changes in pregnancy, but sometimes maybe our own individual bias towards asymmetry. So clinically what we see is a lot of more like left rib flaring and a little bit more overactivity of like the right abdominal wall. And sometimes that makes typical diastasis rehab or prevention in pregnancy tricky, because if you're addressing this abdominal wall symmetrically all the time, you aren't going to impact the change that you want to have.
Absolutely. Even during my own pregnancy, I always noticed like a little bit more like right kind of discomfort from just always being kind of compressed to this side. So it just kind of felt like it was very like stuffy over on the right side of my body. And so when I would find these big right side body openers, it would bring so much more relief. And even now in the postpartum, when I do symmetrical exercises where I'm rowing to my right side and then I row to my left, it always feels so much harder to really get my left obliques to turn on with like a motion that I'm doing on both sides. And so during my own pregnancy, I was incorporating exercises that were more like one-sided, where I would do something different on the right versus the left based on my overall understanding of asymmetry. So can we just break down the asymmetry a little bit more for folks? Because there are common patterns that a lot of us tend to have, and obviously not every person that's listening will have all of the exact same things, but there is a pattern for most of us.
Yeah. So the pattern as described by postural restoration and anatomically really what we see is that our right lung, like just anatomically, our right lung is bigger than our left lung. Our liver, which is like a big, dense organ, is on the right side. And that liver comes underneath our diaphragm on that right side and offers quite a bit of structural support to that diaphragm. On the left side, our heart sits on top of the diaphragm on the left, and our stomach and spleen is underneath the diaphragm on the left side. So we have good support structurally on the right and a little bit of downward pressure pushing onto the front of that diaphragm on the left side. And so what that looks like a lot of times is that we kind of lean over toward the right, and the right abs, so our right internal obliques and our right transversus abdominis, our right rectus abdominis, tend to be a little bit more compressed. And then the left side tends to be a little bit more elongated. And so it's harder, it's like trickier for us to shift our pelvis like back over to that left side and kind of load over that left side because we don't have that same um, like organ support there.
Absolutely. So I think understanding the asymmetry can be one of the key things, especially in the postpartum, to help with healing of diastasis. Other things that I noticed during pregnancy beyond like positioning, and I know positioning plays a big role in pressure management as well. So how well can we move the diaphragm to change the pressure within the intra-abdominal cavity? So for us, when we're guiding our clients through their fitness workouts and for online fitness programs, we talk about positioning during our prenatal lifts and how that can really impact the pressure management. And when we have too much pressure kind of being directed straight into the front of the belly, it's going to cause some abdominal coating where the center of the abdomen pushes out a little bit more than the rest of the abdominal wall. And now, if someone is just sitting and just like chilling, or they're doing an inversion or a more passive position, sometimes the belly relaxes in a more cone-like position. It could just be like baby's positioning, or it's just how their abs are relaxing, and usually not an issue at that point because there's no pressure pushing into it. But if we're seeing that coney under exertion, so I'm lifting a weight overhead, I'm pulling a weight towards myself, or like the two really common ones that we see it, or I'm doing a very core intensive activity and I'm seeing that coning, that means that there's pressure pushing that tissue out. And even though it's already thinning during pregnancy, if we're constantly pushing and pushing and pushing into that tissue with additional pressure, we're going to thin and damage it potentially a little bit more. So I usually compare it to like an elastic band, where if I'm, you put it in your hair like for a week, and by the end of the week, it's just this like floppy band, like similar to our abdominal wall, like we're pushing and pushing and stretching it. It could be because of our positioning, like maybe we're in that more arched, like rib flared position with pelvis tilting forward. So the belly is already in a more stretched position, and then we add additional pressure, so it's easier to manipulate. So during pregnancy, my biggest tips to help kind of protect the core is to, one, focus on positioning. Sometimes it's hard to stabilize ourselves in a standing position, and so if we're noticing a lot of coning, or we're having a hard time finding a more neutral position with our lifts, maybe we come to a seated position, or we find a more supported position, or we regress the movement to something that's easier for us to stabilize in. And then also thinking about pressure management. How am I breathing with this movement to help stabilize my core and also maintain my core integrity? So exhaling with exertion, or exhaling before the exertion. So if I pressing a weight overhead, I exhale, kind of pull belly in, and then press overhead to help me kind of stabilize and maintain the integrity of my core. And so those two things, I think, play a really big role in how diastasis is potentially going to present in the postpartum. But there's other factors as well, like your genetics plays a big role in it, like what type of exercising you were or weren't doing maybe plays a role in it. So there are some, like how many babies you have, how big your baby is. So even with just like Roxanne and I, like we're both sisters. We come from a fairly similar genetic background. I have no diastasis now. Like it didn't really deal with it a lot during my pregnancy and postpartum, healed pretty quickly. While for her, she still has some. It doesn't necessarily mean it's a functional issue for her, but we're from the same family, and we each have our own journey with it as well.
Yeah, totally. And I think, we want to think about approaching, just like we want to approach pregnancy in general, is, when we're working out, we want to be conscious that we're reinforcing these good movement patterns, or reinforcing, our exhalation. We're watching for some of that, like, I've heard it called like hard coning versus soft coning. So if that coning and you kind of touch it and it is squishy, it's usually less of an issue versus I'm touching that coning and it's like rigid, meaning more like traction on that tissue intensity. But I also of the mindset that, yeah, it's like time under tension. So we can go in and do our workout. We could be even like super extended that workout. We could be seeing a lot of coning in that workout. But that's 1 hour of 24.
Yeah.
Right? If we do things as in our cool down, or we do things throughout the day that help optimize our position, it's probably not going to be as damaging as we might think it's going to be. Right? But if we are hanging out all day long or we work out in these really extended positions, have a lot of that outward pressure, then we go and walk around and we're hanging out in that position. Then we sleep and we're sleeping in a really archy position. And we, the other 23 hours of the day, we're also not optimizing our position. I think it's sort of that build up over time that also is a big contributing
Oh, absolutely.
factor. Yeah. So some of those lifestyle things can be
Yeah, we
helpful
have
too.
folks that'll like we'll post a video on coning and they'll or message or email us in panic of like, oh my god, I was coning in my workout. Have I completely destroyed my abs? And I'm like, it's okay. It's not a big deal if it happens every once in a while. Like if you sit up in bed and you see coning, like you didn't destroy your core. I think what you're saying, like if it's all day, every movement that you do, you're like in a super arch position, you're coning with like everything you do, it's probably going to be more damaging as opposed to 5 reps in your workout. You
Right.
notice some coning, like probably not going to destroy your core.
Right. And that the benefit of like strength training in pregnancy, far and like whether it's your abs or the rest of your body probably far outweighs the potential risks and in the postpartum. And from like a research standpoint, from like postpartum diastasis recovery, the research shows we really don't have a lot of good research that we need more evidence. But that of what we do have is like loading those muscles, so challenging our core muscles, whether we have a little bit of coning or not, is actually better for healing than avoiding loading of those tissues and focusing exclusively on like just transversus abdominis connection.
Yeah. So let's talk about postpartum. So during pregnancy, think about your positioning, think about your breathing pattern. If you cone every once in a while, it's not going to destroy your core, but just being overall mindful of your body positioning throughout the day could be really beneficial. But we're not trying to live in neutral either. We want to improve mobility, like be able to change position throughout the day. Now, when it comes to the postpartum, I think a lot of the approaches are similar. Like we're still thinking about positioning and our breathing pattern. And then, like you're saying, loading tissue, also considering asymmetry, because that also can impact how like we're presenting as well. Whether or not somebody had a cesarean birth could potentially impact like their how sleepy they are, like how much rest or what is their nutrition looking like. I think are all like really big factors. So let's talk about approaching healing diastasis in the postpartum, because we'll get folks that'll message us like, hey, I have a diastasis. Am I allowed to exercise? And I'm like, yes, please, please do. Like you
Yeah.
don't have to wait until everything is you have no functional issues before beginning a workout program, because really the exercises that you do in programs are probably going to be what helps you feel good in your body again.
Correct. I feel like a big thing to address in postpartum like core rehab is the changes in the rib cage and the adaptive changes that we make in the postpartum to just live. So, right, the rib cage gets wider. Our diaphragm tends to like descend postpartum because now we don't have a uterus to like help hold that diaphragm up. So our core actually tends to work better in pregnancy because it has something rigid to push against. So now postpartum, we don't have that same like rigid feedback. Diaphragm wants to kind of push down, and that rib cage is now stuck in a slightly like wider position like it was at the end of pregnancy. So if we can address how well that rib cage moves, the diastasis, the ab wall function will happen. Like I'm of the mindset that we don't necessarily need to do a ton like isolation wise to our core. Like yes, but we want those activities to be integrative of what's happening also at our pelvis and our rib cage, and then the ab wall can just function, right? Like our ab muscles, our pelvic floor muscles, these are automatic postural muscles. So just like we don't need to be doing a jillion Kegels, we also don't need to be doing a jillion TVA connection activities without addressing, the position of ribs and the position of pelvis. Because if you're struggling to connect to your or feel your abs, it's probably not because those abs don't work. It's because they're really probably not in a great position to work.
Yeah, absolutely.
And so that's, big. And I think what is really different than like a lot of typical approaches.
Yeah.
So like things when we're like in using things like child's pose and really trying to get the back of the rib cage to expand, or some of those side sitting positions, we're trying to get that side rib cage to really open up. The point of those is to help us reestablish better pressure in the thorax so that the intra-abdominal pressure can be a little bit more regulated. So the compensation in the early postpartum period that a lot of people develop is like we're using our backs for everything. We're clenching our butt cheeks, keeping our backs really tight in order to help hold us up, because now our abdominal wall is not able to do what it was able to do in pregnancy, and it's healing. And so I think a big part of the recovery process is just breaking some of those ingrained habits, or like breaking that patterning down that compensation that naturally comes out of, okay, I'm holding my back tight and that's keeping me stuck in that position. And that's why it's tricky for me to connect with my abs or feel like my abs are working when I'm doing my workout or when I'm just living my life.
Yeah.
And so the techniques, whether they're integrated into warm-ups or cool downs or things that you mix in throughout the day, help us sort of break those habits and then allow us to really see that healing happen.
Let's take a break from this week's episode to hear about our podcast sponsor, Needed. Needed is a nutrition company that specializes in optimizing nourishment for the perinatal timeframe. It is a product that Roxanne and I have personally used throughout our pregnancies and our postpartum, and even Hayley is using Needed's products. One of my favorite products from Needed is their collagen. I love to use it post-workout. I like to put it in my coffee in the morning or even within my oatmeal. It blends really well. It doesn't add much of a flavor. If it adds any sort of flavor, it just makes things like a little bit more creamy. Needed's collagen is a product that I utilized throughout my entire pregnancy. I'm using it now in the postpartum, and I'm really happy with the product. If you want to check out Needed, you can check them out at thisisneeded.com and use code MamastePod to get 20% off your order. We incorporate a lot of like back expansion exercises just to kind of bring us into the opposite position to release that tension in the backside of the body. One of the common, I think, misconceptions in the postpartum and even during pregnancy is that we are tucking our butt underneath and finding more of this posterior tilt. And I think that's where like all the mom butt type stuff, like notions come from. But you did a reel one time where you're like, maybe we're not tucking under, but we are still in this arch position because we have more compression to the backside, and then the hips move forward.
Yes.
And so it's almost like a masked anterior pelvic tilt that looks like a posterior pelvic tilt. And so when folks are like, well, I'm tucking or I'm trying to arch more and it's just making things worse, it's because you're already in this arched position. We may need to actually find more rounding in the back and in the pelvis to help release some of the tension so we can position ourselves better. And so similar to pregnancy, it wasn't necessarily like the exercises that you're doing or not doing, and same in the postpartum. It's how are we positioned and how is that impacting how we can manage the pressure within the abdominal cavity? And like you were saying, how well can the muscles work based on the position that they're in? And I think that's a key thing when it comes to, can I feel my core? How well do I breathe and move with things? So the general like layout of our workouts to help folks recover in the postpartum from these common issues that they may be experiencing is our warm-ups all start with core exercises that are trying to integrate how are my arms and legs moving in relation to the positioning of my pelvis and my rib cage. Like how well can I maintain my core position as my arm reaches overhead or my leg extends down, and we move folks through a variety of positions. And that's how we're starting our workouts. Can I feel all of this stuff that's supposed to be automatic working? And then over time that will become automatic by starting by being a little bit more like mentally aware of things. And then we integrate those concepts into the actual workout. Like, okay, I'm lifting, but as I lift, I'm going to find a more supported position at first so that I could think about how can I keep my core in its position as I move some weight. And then we incorporate rotational exercises, we incorporate back expansion exercises, things to try to help us come out of these positions that we get commonly stuck in. And it's harder with like general programming. Like our fitness program is obviously very specific to a time frame, but it's not specific to the individual. And so because it's not specific to the individual, it becomes hard for us to say, hey, only on the left side
Right.
do you do this.
Right.
On the right side, you favor this. And it gets kind of confusing for folks because we're so used to do everything the same on both sides, even though our bodies are not the same on both sides. And so our programming is do them on both sides. And I think this is where working with a physical therapist can be really beneficial, especially one that has an out-of-box approach to PT. Because there's nothing worse to me than somebody coming to me and say, hey, I've been seeing a PT for 6 months and I still have diastasis. I'm still peeing myself. I still have symptomatic prolapse. And I'm like, okay, have you gotten off the table? Or are you still doing clamshells and glute bridges and Kegels? And they're like, I'm still on the table. They just do manual therapy on me. And I'm like, well, that's the problem. Like if we're not getting off the table and taking the isometric and the isolated exercises and then expanding it to like, how can I make the whole system work better? We're not going to see progress. And similar, like we were talking about, if we don't load the tissue, our diastasis is not going to heal in the postpartum.
Right. So if our abs and back are in like a tug of war, so like back muscles like to take over, ab muscles like to shut off because they kind of work as a team, right? In general, we're not going to see our back muscles be at their maximum, activation. So like if we think of like a sit-up, right? So as you curl up in the front, your ab muscles have to contract, your back muscles have to relax in order to like fully do that sit-up or curl up or whatever you want to call it. And so if we, but those back muscles are holding on tight, they're maybe fighting us. They're resisting our ability to properly do that curl up. But you lay down and you have your back muscles massaged. Is just massaging those back muscles going to change your neuromuscular control, like the control of your ability to do that thing? And functionally, is that going to change how you use your muscles day to day and during your workouts? No, probably not. So that's where, like doing pelvic floor muscle release or doing visceral abdominal work, like all of those things can be awesome. But at the end of the day, we have to teach our bodies how to move and control themselves. And having that one-on-one is amazing. But I think we can learn these things even from global programming. And even when I'll tell clients all the time, it's okay we want to be able to do things on both sides, right?
Yeah.
It's not that it's like breaking any rules, even if you're asymmetrical, to do things on both sides, but it's sometimes a learning moment of like, oh, this feels really hard over here. Oh, this feels super easy over here. And I'll usually tell people, I'm like, well, how about you just start and finish on the side that feels harder. So you're doing just like an extra round on that.
I think that's a good approach.
On side.
So we talk a lot about like asymmetry when we talk about like pelvic pain, and like this week on our Instagram we've been talking a lot about pubic symphysis and SI joint pain and how I was personally approaching it during my pregnancies and how Roxanne approaches it in her postpartum to help address some of that asymmetry that is causing some of the discomfort for us. And we get a lot of questions where folks are like, well, how do I know what I have? Is it like which side do I need to focus on? Because I also have pain and I would like to not be in pain. And I think social media is a really great resource for folks to resolve their pain without having to, I don't want to say like they should never see a professional or like work one-on-one with somebody, but it makes information really accessible so that folks can find relief now. Like they don't have to schedule an appointment and wait 8 weeks to see somebody.
Right. And I think, and not as a knock to my own profession, but even when you do go for individualized care, you're maybe not getting someone who's looking at those things anyway.
Yeah. So what are some ways for folks to tell like, okay, how do I know what is going on in my body. And I think there are some tests that they can do in themselves.
Yeah.
So
Oh, yeah.
like ones for me that I would say, like, if you're doing this exercise, if you feel like it's easier on this side versus that side, this is probably the position that you're in. Or if you do like a 90-90 or a shin box flow, which side feels easier for your legs to be in? Is it with the left leg externally rotated or the right leg externally rotated? So those are some things that like come to the top of my head that I know feel different for me on each side. Like, are there things that folks can use to figure out
Yeah.
for themselves?
Yeah. I mean, so diastasis is always like tricky to talk about for me, because how people understand it and evaluate it traditionally is with like the head curl up test. So you lay on your back, curl up your head, and you feel at that midline, and you're feeling the distance between those two rectus bellies. And you're feeling the distance between those two rectus bellies, and um that's not considering where someone's rib cage is at. It's not considering where the pelvis is at. It's just looking at what's going on at that midline. And so when I evaluate someone's abdominal wall for diastasis recti, um, we're not like, that is one small piece of the evaluation. But you can start to get a better assessment of your entire abdominal wall by just, you can lay down on your back. You take note of what you're feeling in contact with the floor. So if you lay on your back and all you feel is your tailbone and your shoulders, we know that we've got some tension in the back of that body. If you can feel some of your rib cage or some of your lower back or your entire back on the ground, cool. Okay, we're like settling down into the ground. Then I usually a lot of people like put their hands on their lower ribs, and then you can kind of compare side to side. You can compare the angle that those lower ribs take. So infrasternal angle is the angle of the rib cage, and that angle can be, greater or less than 90 degrees, and you can feel that on yourself. Sometimes I'll have people take take your thumbs and hook your thumbs in there, and that can give us a little picture of, okay, well, if I'm really wide on one side and really narrow on the other, or I'm very wide on both sides or very narrow on both sides, then that gives us some info. Then taking your fingers and kind of patting down that abdominal wall, and you can get a sense for the thickness, the integrity of the muscles of that entire abdominal wall. So if you lay down and you feel like your rib cage down to your hip bones feels like more muscular on one side versus the other, that can give us a window into some of that asymmetry. And then I'll often have people even try going like, span their fingers out like this, like span them out like across like this from the rib down to their hip bones. And people will sometimes find that it's smaller on one side versus the other. So like if your index finger is hooked under the rib and your pinky finger can touch the hip bone, and there's a difference between one side versus the other, it starts to give us this little picture of like, ooh, maybe we've got more compression on that right side and a little bit more expansion on the left, or you might find something a little bit different in yourself. And so that sometimes helps give us a little window into that. And so then when we go back and come back to our curl up, right? And we go, oh, I really notice that I'm quite wide on the left side and quite narrow on the right. What happens if I exhale, feel my body shift over to the left side, get that left side coming together a little bit more, then curl up? How does that maybe change what's going on at that midline? And often we see that now those measurements are different, right? We can manipulate
Yeah.
in a moment, from moment to moment, we can manipulate our measurement of that midline. And the research on our reliability of those measurements is poor, right? We're from person to person comparing someone's diastasis. We're not good at that. We know this from research that's been done. And so I like to take a little bit more of like a look at that entire abdominal wall. Is someone really holding on tight to those upper
Little
Is,
guy.
is someone holding on tight? Are you gripping those upper abdominals and maybe overpowering those lower abdominals? Or are we just sort of keeping that entire abdominal wall kind of like clenched and stiff? There's ways that you can kind of get a picture into that, and that it's. I like to show clients, like, again, we can change that diastasis measurement in a moment, meaning, okay, we can optimize how you're creating tension through that midline. Now you can do whatever you want,
Yeah.
right? Like, you can do whatever you want. Do we need to be maybe conscious of what you're doing a little bit more? Will that help us? And so that's really cool. And so sometimes I like to joke with my patients. I go, I don't care about your diastasis. I do, right? And they do, but I care about everything above and everything below that and how we can get it to work.
Yeah. It seems like just body awareness is a key thing when it comes to healing and feeling good in our bodies again, is because even when, like, I think you were talking about, like, you had Casey do a pelvic floor exam on you and
yeah.
your Kegel was like 0 out of 5. And then once you kind of shifted, it was so much better.
Yeah.
And it was all about like positioning. And so it's not necessarily like, because we'll get folks that are like, my doctor checked my diastasis and it's,
Right.
they said I'm going to need surgery, or, my PT checked it and they said I had it. And I was like, and then what? Like, so it's crazy that just shifting your position can make a huge change in how, like, the integrity of your core and the tension that you can generate. Because that applies to so many different movements as well. Like, if someone's experiencing tons of coning or pain or discomfort in this movement and we make a slight tweak, all of a sudden it's gone. I had somebody in the gym today that was having more impingement when she was stepping up onto a box. And I was like, well, let's try to shift like this. And it was gone.
Yep.
Just from a position change. She didn't magically get so much stronger,
right.
like in the 10 seconds that we did the shift. And it was all about positioning, which plays a huge role in how our bodies can operate.
Yeah. And I think it's a huge like potential, and for like, potential healing. Because I think sometimes we hear, oh, I've been diagnosed with diastasis recti, I have this, and now it becomes part of our identity, and now we're nervous about doing things because we've got this label. And it's like, well, hold on. Let's just pause for a second. Let's work on this for a little bit and see what's shaken out.
Absolutely. Another thing, and kind of talking about what we were discussing before with loading the tissues, one of the things that I'll sometimes see where someone is like struggling with healing their diastasis is that they haven't challenged themselves enough. Is instead of it being like, well, you're doing too much, let's regress. Sometimes it's like the heel slides are not going to cut it. Like, we need to get off the floor
Heck yeah.
and like come into an upright position. Like, all of our core exercises cannot be dead bugs and bird dogs and heel slides and Kegels and whatever. Like, we need to take what we're learning in these supine floor positions and move into a position that we operate. Like, we operate in a standing position. This is how we move our human bodies. And so coming off the floor to then integrate our exercises is going to be beneficial. And then loading that tissue with weights. And I think there's less than it was before, but there's still some stigma with like weightlifting as a woman. And like, we're less familiar with it. We're not maybe as comfortable like going to a gym and like learning how to lift weights. It's a little bit scarier. But I'm really thankful for things like CrossFit and like women's focused like fitness facilities to make lifting weights more accessible, because it's so beneficial, not only for this time frame in the postpartum to help our tissues get denser and stronger, it's also really beneficial for our bone strength and density, which helps us long term as well, like even beyond this like small time within our lives. And so if someone is noticing plateauing with their diastasis, hey, I've been doing all of my exercises and I'm not noticing a change, I'm like, have you been lifting weights? Do you feel challenged in the movements? Like, we can't just do HIIT workouts. Like, we need to like lift.
Yeah.
Like,
Yeah. And I think lifting and then looking at what is the function of these abdominal muscles, and the function of these abdominal muscles is not just to work in this front to back plane, but side bending and rotation, making sure that the things that we're doing for our whole body incorporate flexion, extension, side bending, and rotation to work those muscles in all the different planes that they function in, for more complete sort of rehab of those
Absolutely.
muscles. Hmm.
So if you could give someone some advice during their pregnancy and or postpartum when it comes to kind of the labeling of diastasis, where shrink your waist, like mommy pooch, all this like harmful marketing that is targeting like women in this very vulnerable time frame. Our bodies are very different than they were at other points in our life. What advice would you give to somebody who is starting to navigate this and feeling nervous about diastasis and those trigger words?
It is normal for your abdomen to not be perfectly flat after you have a baby. It's perfectly normal for your abdomen to not be flat before you have children. And so that is not an indicator of function. I've had clients with very large gaps whose cores function just fine. I've had people with zero diastasis whose ab muscles don't really work that well and they have a lot of dysfunction, so back pain or whatever. And so a DR diagnosis is not your fault, and it is also not a red light for exercise. And flatness and aesthetics can certainly be a goal, but knowing that you didn't do anything right or wrong if that's not what you have.
Yeah,
Right? And
absolutely.
I think a lot of programs that sell a lot of units use a front person who genetically is really fortunate that they have low body fat and they naturally have a flatter belly. So they're performing exercises, in their own postpartum journeys. And we see that and we want that. And so we buy that thing where we're in a vulnerable place to be marketed to in that way. And then when you actually dig into that programming, it's heel slides. So that's what I would kind of say to that. Like, it's not it's a process. Like, healing our bodies and our core postpartum is a process. And again, you get to decide what your goals are with that, whether aesthetically, functionally, and just because your belly's not flat does not mean
Something's
that
wrong with you.
something's wrong.
Yeah, absolutely.
Yeah.
I definitely find that there are certain marketing practices that are very effective. They're a little unethical in my opinion, but they are very effective, and it's to prey on someone's vulnerabilities. And so if you market to someone that they need to be smaller and they need to fit this aesthetic to be happy and healthy in the postpartum, it's really easy to get people to buy stuff from you, which I've like the before and after pictures, the photos that's just the abs and they're like super flex and the lighting's really nice. Those like irritate the absolute living shit out of me. And it's something that we'll never do at MamasteFit. Like, we'll never do a before and after photo because just because someone's smaller doesn't equate better function, feeling better in
Right.
their body, a better quality of life, which is what we really care about. Like, I don't care. Like, if your goal is to lose weight and to look fit a certain aesthetic, like, I support you in whatever someone's goals are, but that's not like the main focus. We're focusing on function over aesthetics. We want you to feel good in your body. It's a big reason why like I don't normally post a lot of pictures of like look at my abs like 9 months in, 9 months out kind of pictures, because it's not important. Like, it's not important what I look like. Like, sure, if I really marketed like using my own body, I would probably sell more programs because it would be appealing. Like, it's a cheap marketing tactic, and we're not into that.
Yeah, I always, I've had lots of clients who have purchased programs and are coming to me post trying a diastasis program, right? Like, oh, I bought this program that's specifically for mommy tummy and I followed it to a T and I'm not seeing the changes I want to see or whatever. And it's like, we can't like spot lose weight
Yeah.
either. Like, you can't just like do all this like isolated core work and expect that you're going to just like get shredded in your
Yeah.
core if you're not addressing like the rest of your whole body, right? Like you're not going to have like toothpick legs and like this like, super, it's just not how physiology works. Yeah, being able to like zoom out a little bit, approach the system as a whole. And when our whole system is working well, then we can focus in on whatever it is that your goal is.
Absolutely.
Mhm.
Well, thank you so much, Hayley, for coming on the podcast and sharing all your insight on diastasis. Thanks for bringing your little dude too. So if you heard any little noises while listening, Hayley was not farting. It was her baby.
Oh my
Her
gosh.
baby having a blowout.
Oh my gosh.
You guys can follow Hayley on Instagram at Hayley Kava PT. We'll link her info down below. She offers a pay what you want pelvic balance series online, which you can pay $1, you can pay $50, you can pay whatever you want to learn from her in a group setting. Highly recommend the course, especially if you want to learn more about how your body is moving and get support from a PT and more of a group setting. So check out her online offering. She offers one-on-one virtual consults. If you're local to us, you can come work with her in person. So thanks so much, Hayley, for coming on the podcast.
Yeah, thanks for having me.
When it comes to childbirth, a lot of it can be out of our control, and we do need to practice acceptance for sure. But nothing is more empowering than being truly informed. And MamasteFit's childbirth education course does just that. The information is informative, it's thorough, it's organized, it's digestible, and more importantly, it's presented in an unbiased, objective manner, which you don't always get at times when you're taking a childbirth education course. I used this course for both of my births. My first, which was an induction, and my second, which was in a tub at a birth cottage. And I found it so valuable for both of my births. So if you're on the lookout for a childbirth education course, I highly, highly recommend Gina and Roxanne. They do such a great job, and you can tell they are so passionate about informing and empowering others.
Thanks so much for listening to this podcast episode. If you want to learn more from us, check out our prenatal fitness programs and our postpartum fitness programs so that you can have the exercises to help you feel good within your body, to help you feel strong during your pregnancy and your postpartum. And we also integrate a lot of those rotational movements, those one-sided movements to help address the asymmetry that you may be experiencing as well. You can check out all of our fitness programs on our website at MamasteFit.com, and you can use code STORY10 to get 10% off any of our online offerings. And you can even bundle them with some of our other courses to save an additional 15% off. This podcast is sponsored by Needed, a perinatal nutrition company that specializes in optimizing nourishment for the perinatal timeframe. If you want to check them out, you can check them out at thisisneeded.com and use code MamastePod to get 20% off your order.